Hi, my name's Hannah. I'm a doctor and English teacher from England. I make videos about the occupational English test, and I was recently asked by one of my viewers to clarify certain job roles which can appear on OET Writing. And if you're not familiar with the UK or Australian health systems, they can be a little bit confusing. It's a huge topic to cover all of the different job roles in a vast healthcare organisation. However, I'm going to run through the main job roles you might see that pertain to doctors, the different subtypes of nurses that you might need to write to for the occupational English test, other health professionals that you might find yourself writing to, and finally, some non-medically trained professionals who have appeared in the OET writing section. I'll then briefly explain how to use knowledge of these professions to tailor your writing and use the correct amount of medical terminology in comparison with simple terminology. Let's start with doctors. A common role you will see is a general practitioner. These are specialists in community or family medicine, and in the UK they're the first doctor to see with any non-emergency problem. They're able to manage patients from children up until old age. If a patient requires specialist investigation or treatment, they're then referred to the hospital. In terms of hospital specialties, we have surgeons, who are doctors who operate, and confusingly in the UK, they often have the title of Mr. or Ms. instead of Doctor. This is for complicated historical reasons, but they are still doctors, the same as any other doctor. Many surgeons will have the title of what type of surgeon they are. For example, a general surgeon, a vascular surgeon, an ear, nose and throat surgeon, etc. But some have specific names. For example, an obstetrician who's a surgeon specializing in pregnancy, a gynecologist who specializes in female sexual organs, or an ophthalmologist specializes in eyes. For non-surgical specialties, we have medical specialists. They often have specific names depending on what subspecialty they work in, for example, gastroenterologist, endocrinologist, but some specialties don't have an ology type name, and the general heading for a medical specialist in this sense is a physician. So an acute physician specializes in the first few days of someone's stay in hospital, a respiratory physician specializes in the lungs, etc. We then have other types of doctors. For example, a pediatrician specializes in children, an anaesthetist specializes in making sure people are asleep. These are referred to as anesthesiologists in the USA. And check out my full video on anaesthetists if you're interested. We also have intensivists, who are doctors specialized in intensive care, radiologists, doctors specialized in the interpretation of scans, and emergency medicine specialists, doctors who are specialized in working in an emergency department and stabilizing acutely unwell patients. This covers most of the specialties. However, in the UK, doctors have to work for a long time to specialize, and while they're specializing, they're referred to as junior doctors. Let's move on to other healthcare professionals. Most of us know the main roles of a nurse, but in the UK healthcare system, there are many types of nurse. For example, we have a matron. This is a senior nurse who is in charge of usually a large department within a hospital, or a community matron having a management role in nursing in people's homes. We have community nurses and district nurses who both work with patients in the community, usually in their own homes, and practice nurses. These work with general practitioners and will work in a community health centre or practice. We have community psychiatric nurses. These are nurses specialised in mental health, and again will work in the community in either health centres or in people's homes. Also in the UK, we have nurse practitioners. These are nurses who have taken extra courses, qualifications and exams to be able to practice more independently, and in some cases they can prescribe medications on their own. And related to nurse practitioners are advanced care practitioners. These are similarly healthcare professionals who have taken extra qualifications to take on a more independent role, and they may come from nursing or from other healthcare backgrounds. And then let's look at allied health professionals. These are professionals who have taken courses usually at university and are highly specialised in one particular area. For example, a physiotherapist. This is an expert in musculoskeletal conditions and can diagnose and treat conditions through advising of exercises or giving physical therapy. An occupational therapist is specialized in assisting patients, often with disabilities or with health conditions, into how they can best function. A midwife is specialized in pregnancy and specifically in giving birth. A radiographer is qualified to deliver radiation and scan patients. This is in contrast to a radiologist, who is a doctor who will prescribe and decide the type of scan necessary for a patient and interpret the result, whereas the radiographer is qualified to physically give the scan. A dietitian is specialized in nutrition for a patient, and be careful with the terminology in the UK. A dietitian is a protected term with a professional body. A nutritionist, on the other hand, is not a protected term. So anybody, regardless of their background, could legally refer to themselves as a nutritionist. A speech and language therapist is specialized in not only how to improve people's speech and language, but also in swallowing difficulties. An operating department practitioner is qualified in assisting during surgery, either assisting the anaesthetist, assisting the surgeon, or assisting in the immediate recovery of a patient. There are many, many more allied health professionals with very specific roles, and if you see on your OET writing that you're writing to a technologist or a technician, they're likely to be an allied health professional specialized in a particular area, often involving complex medical equipment. You also might see a lactation consultant. This is somebody specialized in assisting women breastfeeding. We have paramedics who are specialized in immediate care of a patient, who will often arrive with an ambulance to stabilize a patient and to keep them stable while transferring to hospital. And an optician specialized in eyes. Again, contrast with an ophthalmologist who is a doctor subspecialized in eyes and can prescribe medication and can perform surgery. An optician is qualified in equipment involving the eyes and will be a specialist in advising on contact lenses or glasses, for example. Having looked at doctors, nurses and allied health professionals, we need to think about how we should be writing to these professionals in the exam. Both doctors and nurses have a broad background of training. So they will have some familiarity with a large number of health conditions. And in general, unless you're talking about something very, very specialized, you can be comfortable using medical terminology. However, when we look at allied health professionals, their background and training is often in a lot more narrow focus. So if you are a physiotherapist writing to another physiotherapist, you can use a lot of very technical words that are related to physiotherapy. However, if your role is to write to another allied health professional outside of your specialty, it would be advisable to use less jargon, as they may not be as familiar with the terms related to your specialty. For example, if you are writing to a lactation consultant and you are a nurse, they will be familiar with any terminology directly relating to breast care and breastfeeding. However, you would need to explain anything else that's happening with the patient in lay terms, as they may not be familiar with the vocabulary. Now let's look at non-medically trained professionals to whom you might need to write in the OET. You commonly may need to write to a social worker. This is somebody who is trained in social work, which means helping patients with difficult situations, for example, who might be facing homelessness, or helping involving safeguarding vulnerable children or vulnerable adults. They have no specific medical training, so I would avoid any use of jargon, and I would explain anything medical going on with your patient in very clear terms. A warden is somebody who looks after a residential area for elderly or vulnerable patients. They are very unlikely to have any medical background, so again, I would explain everything in clear, simple terms. A nursing home manager is somebody who runs or is in charge of a nursing home. A nursing home by definition has to have nurses in it, and therefore many nursing home managers are experienced nurses who have progressed in their career to manage the facility. However, this is not necessarily the case, and they may have come from a management background and not have a nursing background. Therefore, if the notes are not clear, I would not assume they're a nurse, and I would still explain any medical terminology. A practice manager is in charge of a GP practice where general practitioners work. In the majority of instances, a practice manager has a management background and not a medical background. So again, I would explain any medical technicalities very clearly and using simple language. Finally, a medical secretary. This is a secretary who works in a medical capacity, often typing up notes or helping to organize a doctor or a nurse's schedule. Although they are often familiar with medical terminology through having used it a lot in their day-to-day work, I would still, if you need to write a letter to a medical secretary, explain things in clear lay terminology. I hope you enjoyed my video. Don't forget to give it a thumbs up if you liked it. Let me know if there's any other videos you want to see in the comments. Check out the other videos that I've already done that should be popping up around here somewhere. Please subscribe to my channel to get more OET related videos, and best of luck whenever you're taking your exam. Bye!